We have a measles vaccine martyr on our hands, folks. I am so sad about how this whole situation happened with this poor girl in Texas who died from measles. And I'm using quotation marks because she didn't actually die from measles. She ended up dying from pneumonia. What's interesting is all of this media propaganda, fear mongering around, well, she died because she didn't get her measles shot, that, and then she died from measles, is the reason we now know what actually happened because people were curious and wanted a release of her medical records. And so her parents came out to tell us what actually happened. And then there have been physicians who have read her medical record to determine what actually happened when she went to the hospital. So let me tell you what happened. Right out of the gate, she did not die from measles. Yes, measles caused the pneumonia because viruses can cause pneumonia, but a lot of viruses can cause pneumonia. Flu, a common cold. I got pneumonia when I was in high school. I'm a perfectly healthy high schooler back then, and I got a common cold. And then a few days later, I developed pneumonia and it got worse. And I went to the doctor and they gave me treatment and I was fine. So essentially, this is what happened to this little girl. So the parent said she was 6 years old. She had measles for about 2 weeks and it was going away. The rash was finally disappearing. She was getting better. But then she started developing a really bad cough. So the mom brought her to a doctor's office, and the doctor's office just simply gave her cough syrup and said, go home. My guess is they said, go home, you have measles, we don't want you in here. And I don't even know if they touched her or checked her or put her in a room or did a chest x ray. They just said, go home, you have a cough, here's some cough syrup. So they did. They went home, they gave her cough syrup. She didn't get better. So after a couple of days, she started having some breathing issues. So they brought her to the hospital this time. And that's where they found out she had pneumonia. She had some fluid in her right lower lung, is what I was told. And that was diagnosed as pneumonia. So what they did is they started antibiotics right away, IV antibiotics, which makes sense. However, they treated the wrong bacteria. And here's why. She was not previously hospitalized or in any other healthcare institution that would make her at risk for antibiotic resistant bacteria. So like MRSA, Pseudomonas, she wasn't at risk for those because she came from the community, which means you treat as a community acquired pneumonia. So you pull the guidelines for community acquired pneumonia because that's where she came from. She didn't have risk factors for hospital acquired pneumonia or any healthcare setting pneumonia. She had community acquired pneumonia. And when you have community acquired pneumonia, you treat two different types of bacteria pneumonia. You treat the methicillin susceptible Staph aureus, which is a beta lactam like ceftriaxone. And then you treat the atypical bacteria like mycoplasma, and you use a macrolide or a fluoroquinolone for that. So that would be your azithromycin or your levofloxacin. So the guidelines say if it's community acquired, you need to treat both the staph and the atypical. So you would use the ceftriaxone with azithromycin or the ceftriaxone with a fluoroquinolone. And they didn't do that. They did the ceftriaxone, but instead of treating for atypical, which is what you get from the community, they treated for MRSA, which is a methicillin resistant Staph aureus. So if it doesn't respond to the ceftriaxone, that staph that responds to this, they're treating with vancomycin, which will treat if it's resistant. But you usually only treat MRSA if they've been in the hospital or a healthcare setting. So right out of the gate, they chose the wrong antibiotics. She didn't have risk factors for MRSA. She shouldn't have gotten vancomycin. She should have gotten something to treat the atypical bacteria in her lungs, but they didn't do that. Okay, so now they have her on ceftriaxone and vancomycin, but a day later, she's still not doing well. So as a provider, you think, why isn't she getting any better? Her symptoms are not improving. She's getting worse. Now they're thinking ventilation, and they put her on a mechanical ventilator, which they didn't do breathing treatments, I also was told, because probably they were worried about aerosolizing measles into the air. They didn't want measles because it's highly contagious, but so is a cold. So they didn't do breathing treatments. They just went straight to a ventilator. So now she's still on the wrong antibiotics. It's day one, she's getting worse. Cultures aren't back yet because it takes about 2 or 3 days to get a full culture to know exactly what bacteria you're dealing with. So day one, she's getting worse. They don't change the antibiotic. Day two, she's getting even worse. They still don't change the antibiotic or think, are we doing the right thing? Um, Maybe we're not treating the right bacteria here. So they didn't change it. Day 3 rolls around. She's even worse. And now they get the cultures back. And the culture shows Mycoplasma pneumoniae. Oh, the atypical bacteria that would have been treated if you had treated her appropriately the first time. So now they change the antibiotics. So they keep the ceftriaxone, but they take away the vancomycin and they order the azithromycin, which they should have ordered the first time because that's what the guidelines said, but they didn't. But the really bad thing is they ordered it at 11 o'clock at night, and the chart shows that it wasn't given until 9 in the morning the next day. So it took them 3 days to find out they were treating with the wrong antibiotics, and then another 10 hours to get the right antibiotic on board. And unfortunately, at that point, she had so much inflammation, so much sepsis, and third spacing in her body that her heart just died. And she went into cardiac arrest and ended up dying. And it was because we just didn't treat her. And I feel like there are so many points of failure in her case. And she didn't die from measles. She died because of either medical incompetence at best or medical neglect at worst, right? She should have been evaluated in the doctor's office first. And because she wasn't, it got worse. And then when she got to the hospital, she should have been given the right antibiotics right away, but they didn't. And then the third step where they went wrong is once they found out she needed a certain antibiotic, it still took them another 10 hours to get it to them. So just the whole treatment of this poor girl is just atrocious. The other thing that really bothers me is the parents were saying that when she was admitted to the ICU, they weren't allowed to stay overnight. And the parents were kind of like, well, there wasn't a bed. It was a small room, which is true. Most ICUs don't have beds. They have like a chair for a guest. But if that was my baby, I would not leave my child's bedside. My 6-year-old, no, I am staying there until they're discharged home or my husband comes or my mom comes to trade shifts. But like, I am not leaving my child's bedside. That's my child. But the reason they wouldn't let them stay is because they were worried the parents were contagious for measles. Again, this incredible fear of a virus that's pretty benign for the most part. And people will argue, well, that's what caused the pneumonia. Well, I'm arguing measles may have led to pneumonia because it is immunosuppressing when you have a virus, but any virus can lead to pneumonia. The problem is she didn't die from measles, she died from medical neglect. We just didn't treat her the way she should have been treated. And this poor girl became a martyr for the vaccine industry, saying, look, she died because she got measles because she didn't have the MMR vaccine. If she had had the MMR, she wouldn't have gotten measles. And if she hadn't gotten measles, she wouldn't have gotten pneumonia and she wouldn't have died. Sure, she may not have gotten measles, but the fact is she got measles and we just didn't treat her at all appropriately. And this poor girl, this poor family is going through so much grief and blame for basically medical neglect for this poor little girl. So I'm just setting the record straight. It's nice to see the records and actually know what actually happened, because the fear mongering around this girl died from measles is not true. So really, out of this measles outbreak that's happening across the country, we've had 0 confirmed deaths. There's been 1 confirmed death, that's the little girl, but turns out she didn't die from measles, she died from mistreatment of pneumonia. And then the other death, the person had measles, but no one has said how they died. Did they die from measles? Did they die from a car accident? They just happened to have measles. So there's only been 1 confirmed death, and that's the little girl that ended up not actually dying from measles. So pay attention to the media. Don't get sucked into their fear mongering, because they can spin it however they want. And I just wanted to set the record straight on what happened to this poor, poor family.